So I think not only for New York State, but for any state or city that is facing similar problems, without substantial mitigation, the middle of January can be a really dark time for us.
Dr. Anthony Fauci making a guest appearance during Governor Cuomo's briefing this Monday, urging Americans to hold fast as the full brunt of the holiday season, travel, and gatherings associated with it won't be known for weeks. New York State's infection rates are now 4.27%. Hospitalization rates, however, being monitored more closely. It will become the real measure for future restrictions and closures. What is different this time around versus the spring, upstate New York's hospitalization rates exceeding that of New York City and Long Island. In the next 5 days, should the city's numbers not stabilize, the governor says the comforts of indoor dining will be shut down across all 5 boroughs. For areas outside of the city, capacity reduced from 50 to 25%. As for when those restrictions would be lifted,
you would have to see a stabilization or a reduction. Frankly, we're looking at the opposite situation. We are looking at continued increases from now through mid-January.
Elements of the governor's newly announced surge and flex plan for managing hospitals also going into effect. Across the state, Cuomo wants hospitals to expand their bed capacity by 25%. He's also reinstating licenses for retired doctors and nurses. This is to address any strains on staffing across all state hospitals, both public and private.
Every night, we get an inventory from every hospital doctor. How many patients do you have? How many ICU beds do you have? What capacity do you have? And we do that on a daily basis. If our hospital capacity becomes critical, we're going to close down that region.
Mayor de Blasio says he and the governor are in constant communication. This as several neighborhood numbers reach alarming levels, as indicated by the darker coloring on the city's COVID tracking map. Staten Island, in particular, once the borough with the lowest death rate, now has the highest.
If these numbers don't level off soon, then all options have to be on the table. That's the decision the state will ultimately make. But I think everyone is seeing the trend and very concerned.